Now, Rock from the Heart is excited to introduce a new form of discussion, a physician-patient discussion. Dr. Tyler Wallen is a general surgeon specializing in cardiac surgery, practicing at Geisinger Health in Wilkes-Barre and Danville, Pennsylvania. Dr. Wallen attended the Lake Erie College of Osteopathic Medicine, where he earned his Doctor of Osteopathic Medicine. He followed this with a residency in general surgery at Mercy Catholic Medical Center in Philadelphia, and a fellowship in cardiothoracic surgery at the University of Florida in Gainesville. His clinical interest lies in transcatheter valve replacement and aortic thoracic disease, and treats his patients for a wide variety of cardiovascular issues. Along with being an active member of multiple surgical societies, Dr. Wallen gives of his time and expertise by volunteering with the International Children's Heart Foundation, offering his surgical services to children across the globe. He is joined by Robyn Peacock and John Toivonen. Sorry if I butchered that. John shared his patient story with Rock from the Heart last year and has become an integral part of the mission of positive patient mindset. John is a father of 4 lovely daughters, and with his wife, Nicole, lives the Minnesota hockey family life. Thank you, Dr. Wallen, Robyn, and John, for this conversation, sharing both the physician and patient point of view on a topic we all know too well. Welcome.
All right, thank you. I can't thank you all enough for having me here. It was a relatively smooth trip from Pennsylvania out here, and although as silly as it sounded to tell my colleagues I was heading out to Minnesota in February, I'm very, very happy to be here.
Oh, that's great. Awesome. Thank you guys for us coming up here. And this is kind of a different thing for Rock from the Heart. I know Dr. Tyler has done this before, patient doctor forum. So we're up here to help with that. So we are very blessed to be invited on this stage with Dr. Wallen to kind of just ask questions and have an open discussion. So we had our introductions, and I think we're just going to kind of get right into it. So I'll go ahead and ask the first question. So we've heard a lot about advocating today, advocating for yourself, things like that. We've heard about patients connecting with their care team, their doctors, their nurses, everybody that's involved with surgery. How important is it to you as an MD to have that same connection back?
It's critical. It's absolutely critical. I think one of the things that attracts those of us who like to take care of aortic disease to the field is the fact that, unlike most of my surgical patients, back to my general surgery days and through my cardiac days, where you sort of have your operation, you have your follow-up appointment, and everything looks good at a month, and it's like, see you later, let me know if you need anything. Your aortic patients are patients for life, right? Most aortic surgeons are going to see their patients yearly or every other year for either the rest of their life or the rest of your life, right? And so that establishes a much different relationship than most heart surgeons have with most of their patients. That's an attractive thing to me. It's one of the things I like about the field. And I also think it's critical, as some of my colleagues mentioned earlier, even before the operation, it's about balancing a risk and reward system, and that's different for every single person, right? It's obvious to say that the risk of surgery is different in a 55-year-old otherwise healthy person as compared to an 85-year-old with mobility issues. But there's a huge spectrum of things that exist in between that. And only when you have that relationship with your patients can you adequately assess that risk-benefit ratio and then provide the best care that you can for them. So I think it's critical. It's absolutely critical.
That's great. That's great. So I want to ask you if you can talk a little bit about cardiac rehab. So with people that I come in touch with, a lot of people ask, why do I have to do cardiac rehab? My insurance isn't going to pay for cardiac rehab. What can I do? How do you handle cardiac rehab with your patients?
Sure. My personal practice is to recommend cardiac rehab for everyone. I usually see patients at 2 weeks and 4 weeks post-surgery. If everybody looks good at 4 weeks, then I recommend them out for cardiac rehab, and I do that for a couple of reasons. One, I think our physical therapists and occupational therapists are unsung heroes in the medical community. I mean, they do tremendous things for patients. I usually tell folks, I can save your life, but it's going to be the PT who gives you your life back. And that relationship, I think, long-term is really important. The other thing is, we're all busy humans, right? And I'm sure if I asked for a show of hands, there'd be plenty of hands up that'd say, who thought they were going to work out today but then didn't do it, right? And I'm in that group. And I didn't even pack workout clothes, to be honest. But that said, if you have an appointment, most of us are sort of, good patients and good soldiers will keep our appointments. So if I set you up with cardiac rehab and you have an appointment and someone's counting on you to be there, you're more likely to go. And when you go and you get the therapies that you need, people recover faster and they have a better quality of life. I have a lot of patients that go once or twice, and then they figure it out and they know what they need to do, and then they can do it on their own and they're really motivated, and that's great. I have other patients that go for 6 months. I have other patients that go for a year. But it's very rare that information's a bad thing, right? So even if you just go once and listen and hear what the therapists have to say and find out what the deal is, that information is valuable in and of itself, even if you never go back. So, my personal 2 cents on cardiac rehab is that anybody who has an operation should make an effort to at least hear what the folks at cardiac rehab have to say. I will also say that there's a lot more avenues now. We do a in-home virtual thing with, we give you an iPad. You don't even have to have your own iPad, and the therapist will meet with you over Zoom and do all things like that. And so there's a lot of opportunities. But I think it's critically important, and I think if nothing else, just having an appointment that you have to keep is a good thing.
Awesome. And before we move on, you were so close with my name. It is Toivonen. With Finnish names, you pronounce every vowel, but so close. I never expected people to get it right. So in kind of our pre-meetings leading up to this, you talked about patient follow-up and a lot of the questions that you go through and a lot of the data that you collect afterwards. Can you elaborate a little bit on that for these folks today? Because I think that's very important in the research you do.
Sure. I think I might be sort of speaking to the choir here, given that you're all here, but, when you have, let's say, a type A aortic dissection that was discussed in the last talk, the area that's the immediate threat to your life is taken care of. That area is resected, replaced with a graft, whatever the case may be. But the rest of your aorta is still in there. And it's still at risk. And we know from other long-term studies that the lifetime risk of needing a second aortic operation, which is frequently an endovascular or minimally invasive operation, is somewhere around 12 to 15%, which in the medical world, 12 to 15% is like an astronomically high number. So follow-up's critical, because if we can identify those folks who need that intervention before a complication or before an emergency happens, just like your first operation, it's going to be much safer. So we know that good clinical follow-up meaning, seeing somebody and talking a little bit on how you're doing, getting the appropriate imaging you need, echocardiograms, whatever the case may be for your situation, is really important. It's important in staying ahead of the problems, because playing catch-up is always much more difficult. In terms of my own work that you hit on, we up in Pennsylvania where I work, we're an integrated health system, right? We have multiple sites across eastern and central Pennsylvania. We're all linked under one big electronic system, and we're also the biggest insurance provider in the area, right? So theoretically, if anybody should know everything about their patients, it should be us. And we recently went through and we pulled all our aortic dissection patients and saw what was our own adherence to appropriate imaging follow-up, and I'll save you the drama, it was pretty poor. And that's sort of what we like to think of as the best of all scenarios, right? And so we're now looking at ways that we can figure out what leads to that. Are there things we can do better? Are there things we can educate our patients about better that can increase that adherence, drive that follow-up rate higher, and then hopefully prevent some of the secondary aortic emergencies that we come in contact with?
That's great. I just had a question. And with brain fog, pump head.
Very real.
Very real.
It's very real.
So one of the things that I was struggling with or challenged with when I was diagnosed in 2007 was the limitations. Once I learned that I had the aneurysm, I had exercise limitations, I had heart rate limitations, those types of things, but yet diet and exercise is super important. But here I am, I'm not supposed to have my heart rate over 120, and I'm on all these medicines to keep my heart rate low. And so how do you handle that when you've got a patient that obviously struggles with weight, but needs to exercise, needs to keep going? Because I do think that going into open heart surgery with a stronger heart muscle helps with the better outcome.
Yeah, and I think you hit it right on the head in that exercise is good for everybody. It's good for people with and without aortic disease, right? And so I can give you how I handle exercise for my own patients. I would leave the caveat that this is by no means endorsed by the American Heart Association or anybody else. But I usually tell my patients that aerobic exercise is fantastic for you in a variety of different ways, not only from your cardiovascular, but also your cardiopulmonary, your mental health, all that sort of stuff. So if you can get out and even do something as simple as go for a walk every day, that's going to be phenomenal for you. We often think of exercise in terms of what we grew up with, right? So my boys are in the hockey playoffs this weekend too, right? So we think of exercise as being out there and skating suicides until you're covered in sweat and you're collapsing on the goal line and you can barely catch your breath, right? And that is a form of exercise, but it's by no means the only form of exercise. So things like walking, light jogs, swimming, cycling, the elliptical, they're all sort of low impact, low stress activities that will still provide you the benefits of cardiovascular fitness. So I usually tell patients that from an aerobic standpoint, I would give you free rein. You can do whatever you want, whatever makes you happy doing cardio work. There are people who put heart rate constraints on some exercise. I usually don't get that sort of nuanced with it. The vast majority of my patients are on a beta blocker, so typically that's sort of a little bit protective. And then even for lifting, I tell people if you can lift something and hold a conversation while you're doing it, that's okay. If you have to hold your breath, if you have to squeeze your belly, if you have to grunt, if you have to stop what you're doing, then that's probably too heavy. Right? And so, cardiovascular fitness and exercise is good for everybody, and it's good for people with and without heart disease, and it's particularly good if you are in your situation where you're preparing for an operation. As simple as it sounds, the better you are going in, the better you are going to be coming out. So coming up, showing up fit is important. The other thing I'll just touch on that you mentioned is a good diet, right? So anybody who's visited their cardiologist has probably been told about the importance of diet. I usually tell patients, we had a saying when I was in Florida, which is that you get fit in the gym, but you get skinny in the kitchen. And so, a good diet and all the things that go into a good diet are just as critical as exercise.
Thank you.
Awesome. So now up here, you are not a scary doctor. You're just a guy talking to a crowd of survivors.
I hope
Okay.
I'm never the scary doctor.
Right, exactly.
Yeah, that's fair.
So what can you, as an MD, tell us as survivors? Because we've heard kind of a theme today that sometimes us as patients don't want to speak up. We don't want to advocate for ourselves. We don't want to ask the questions. We just want to follow the regiment. We don't want to challenge. What can you tell us as patients here now that would give them ease to speak with their medical professional about those questions, those concerns, and things that they have going on?
Sure. I think there's a couple of things. Some of them are kind of half funny, half serious, and others are not. I mean, first and foremost, I would say most of you guys probably pay your health insurance premiums, right? And you go to the doctor and you pay your copay. So you're paying for that time, right? So it's well within your right to use that time as you see fit. Just as it's well within your right to ask any question that you want or take the conversation whichever way you want to go. I know that's almost sort of a silly economic version of it, but don't forget that, right? You guys are the ones who are in control here. And second, I would say, I love a good educated patient, right? When you sort of have to start off on, a very basic level of what's the anatomy and physiology of how the heart works, it can take a long time to get a patient to understanding their disease. When a patient comes prepared and they've done some reading and they have very pointed questions, I personally find that very enjoyable. It's a much better experience for me when I have someone who I know, okay, this person's invested, right? This person wants to know, they want to understand, they want to take care of themselves. Those are the kind of patients we all hope we have. I understand that probably not every physician in the world shares that viewpoint, and there are some people who practice in a paternalistic fashion where it's sort of like, this is what we're going to do, boom, 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 move on, next, I got an appointment every 15 minutes for 9 hours, so I got to go, right? And that's out there, and it certainly is, and I would say, one, you should never be intimidated by the fact that you're dealing with someone who's a medical professional, right? We have a high amount of education and training in a very narrow field, right? That doesn't make us some type of superior being, right? That just gives us training and education in a very focused fashion. So there's no class system when it comes to your interaction with your healthcare providers, and you should keep that in mind. And then the other thing I'd say is, and I almost hesitate to say it out loud, but don't be afraid to walk away. I mean, if you have a practitioner that you're not jiving with, that you're not getting what you want out of, it's okay to look elsewhere. It's not your wife, it's not your husband, you're not breaking up with anybody. Like, that's just the way it goes, right? And so, if you have somebody who doesn't provide the things that you think you need, it's okay to look elsewhere. And I think there are a lot of people who we heard earlier about transfer, right? There are a lot of people who can't get transferred for whatever reason. They're too critical, they're too sick, whatever the case is. So they get taken care of in a hospital and they get a good operation and they survive. But when it comes time for follow-up, that might be the time, to sort of transfer yourself to a place that has more of the resources that you need or provides more of the things that you think you need moving forward, right? Every relationship's a two-way street, and the surgeon-patient relationship has to be a two-way street too. And so, I think that if I could, the sort of take-home points would be, one, I enjoy it. A well-educated patient is a pleasure for me. Somebody who comes in and they're informed and they want to talk is an enjoyable, experience. The hardest question I answer in my entire career is, what would you do if it was you? Because, I don't know what to say, because whatever I say, they're going to say, okay, that's what I want, right? And so it becomes very, very difficult because I'm not you, only you're you. And as silly as that sounds, that's really important. So, I would say it can be uncomfortable, right? Whenever there's this knowledge gap that seems so huge, but you kind of have to get over it because that's the best spot for you to get what you need out of your healthcare team. And then the other thing I would say is if you've got somebody who just shoots down your questions and won't address you, that's probably not the person you want to be taken care of by.
I have fired 2 doctors, by the way.
And I'll try not to make it the hat trick.
Exactly. Don't make it the hat trick. And just to add to that, I would like to say that, we trust in our medical providers to guide us in the right direction, but they're not going to have all the answers. We're the ones that have had our chest open, not them. So that's one thing to remember as a patient. But if you have a great medical team, they should be able to point you in the right direction. And before we end this, I just want to go ahead and thank Amy and Pete once again for putting on this event. It was such a wonderful event again. Thank Megan for the great speaker lineup. This has been awesome. Thank you very much. All the speakers, everybody that came here today. So to finalize it, Dr. Tyler, what would you like to leave this crowd with as a lasting impression?
Yeah, I think first of all, everybody needs to understand, this is geared more towards the patients and the survivors in the room, that this is a Herculean task that you're undertaking. I half joke with my patients, but I mean it. This is enjoyable for me, right? I like operating. But this is the 180-degree opposite for you guys. So, give yourself the grace to recognize how difficult this is and how well you're doing at it, right? So that's number one. And I think number two would be to remember that if you just looking around the room, right? So we have colleagues in electrophysiology here, cardiology, pharmacy, vascular surgery, right? So the only person who really talks to all of us is you. Right? So don't forget that you're at the center of your experience and that you have to be the advocate who gathers all the opinions. You have to be the one who reaches out when you need it and understands what you need moving forward because, we're one part of a big team. Like obviously every team should have a quarterback and we hope you all get what's the appropriate reference? It's probably not Tom Brady in this crowd, but something of that nature. Jalen Hurts in my case. So
Fran Tarkenton.
And remember that control rests with you ultimately. We are here to help, but ultimately the control and everything moving forward has to come from you guys. And obviously by just being in this room, you're already stating that you're really good at that. So don't forget that.
Awesome. Give it up for Dr. Tyler. Robyn, thank you once again, guys.